Welcome, Tilda, to the show. Thank you so much for joining me on the Green Nurse podcast. You are a pioneer in all things nursing. You've written more nursing books than I know. Such a wealth of knowledge. We've had many conversations. I can't wait to get into it today. But before we get started, I think maybe the best thing is that, maybe you tell us a little bit about yourself, your background, and maybe even a little bit of a story as to like how you got into nursing. Did you choose nursing or did nursing choose you?
Oh, good one, Amy. Good question. I like how you say I'm a pioneer in nursing, but I don't see myself that way. I do see myself as a pioneer in writing about nursing. I just mean don't be
All
picky
right.
with my words, but I'm no pioneer in nursing, but although I've been called that because I'm so old, someone said you're like a pioneer. I'm 67, anyway. But what I think I have contributed that is unique, and I hope to have spawned a whole and you're part of it, and more nurses writing and telling their stories and documenting that. But I do think I have started. I mean, there were probably nurses before me doing it, but I think I did start something, and I hope it's a trend to get our voices out there, not just to one another. We speak well to one another. We are full of all of our, all the literature that we write and share it with one another, academics sharing to one another. But what we don't do often enough is talk to the public about what nurses do, what we do, and that's what I'm all about. And
And I think that's
your question
important.
about
Like,
did nursing choose me? I fell into
yes.
nursing. It was my salvation because I was trying to find something I could do that I could support myself and that was familiar to me. I had grown up in a family where I was the caregiver, child caregiver. It was crazy, but that's what I did as early as I can. My earliest memory is of taking care of others, primarily my parents, and who were both unwell. And I think that just nursing was familiar. I fell into it. I thought, oh, I can do this. And it's got to be easier taking care of strangers than taking care of one's own family. And for the most part, that is true.
Yes, I would definitely echo that because again, doing both, obviously taking care of your loved ones is so challenging. There's so many other layers of complexity that adds to that kind of caregiving element. And I think that that's probably why, for example, in those we see them in medical dramas, but it's also true in real life that like if your loved one is the one that comes into the ED, you're not going to be the one that takes care of them because there's just so many other factors at play.
Exactly.
And I also like the piece of mentioning that, and I think we do the same thing in terms of having this conversation that we are really good at knowing what we do. But when it comes to the public knowing what we do a very poor job of conveying the expertise, the knowledge, what we bring to the table as nurses. We still need to work on that piece. And I'm so glad that you've been doing that for the past, I should say pretty much your entire career. And I think that we do need more nurses public facing, letting the public know what we do because there is a huge disconnect. I've seen it, whether it's through media challenge, through, let's say television. Some shows do a little bit better in terms of depictions like The Pit. But I think that there are so many missed opportunities that because nurses don't take up space in that way, that we miss out being the narrators, the story writers, the people who are telling the public what it truly is to be a nurse and what it truly looks like. So I think it's important that we continue to do that work
You
and that you
certainly do
continue to
that
do that
work,
work as well.
Amy. And I would add to that media commentators commenting on the media because every story about health pertains to nursing. Any story, you name any
You're
story that
100% right.
and you do that. You really do that well. I really appreciate and admire what you do in that space.
Yeah, I mean, I slither into there whether they want me to be
Yeah.
there or not, because again, it's just how can we talk about healthcare if we don't talk about
And so many
nursing?
discussions do involve, you can hear it all the time talking about healthcare and the voice of nursing that is not even mentioned. It's just sort of not on
Yeah,
the
it's
table.
it's a funny thing how it gets left off, right? Again, that's why we just have to kind of insert ourselves in. I want to talk a little bit more about your origin story because we didn't really touch on that. And maybe you're being shy because there's a lot of work that you've done. I know you've been a staff nurse in medical surgical units. You worked at the ICU at Toronto General Hospital for what,
That's
20
right.
years or more? 20
Or I
years?
think it's 28. I last
Or
calculated. Yeah, 28 years I was there.
right. And you describe yourself as someone who is practically born as a nurse. So, what was the moment that you realized that nursing wasn't just a career, that it was something that you fundamentally really wanted to be a part of?
Well, it became a career much later. As I say, the early days, it was like a job, a paycheck. It was really
Right.
salvation, as I say,
Putting the
because
hours in.
I was young. I thought, what can I do, and that I can support myself because I was on my own in every sense of the word, and I just was on my own. I had to generate a salary, and I knew I could do this because I had always done that. And so that's kind
Right.
of the sort of sad little story that brought me into it. But of course, it became so much more to me than that. It became family to me because I was lacking that and I wanted that so much. In the ICU, I found a group of nurses that I worked with very closely and we became friends and still are to this day. And I wrote about them extensively in my first book, A Nurse's Story. So it became many things, even more than the job. Then it became family, as I say, and home. And it became career for sure, although I did stay in the same place in critical care for a very long time, and you can have a career there, of course, but people often ask me, young people especially, "Why did you stay so long? How could you have stayed so long?" But I loved it. It was my team, it was, my people. I felt part of it. It was a healthy work environment in every sense of the word. I was always learning, and, as my friends say, "Oh, you just stayed for the stories." Well, there are a lot of stories there. That is true, but
Yes.
there are stories everywhere, so it's not just in the ICU, although it's very dramatic. You know, the pit is great. You mentioned the pit, but it's emerge. It's the emerge department. There are other stories to be told that are more ICU stories about longer relationships with patients and families and all kinds of things that happen in the ICU that you don't see in emergency department. But that's a story for another day.
Well, I mean, who knows who's listening? I think again, it's always important that other stories are told, right? Like, I
That's for
think it's,
sure.
you're
Well,
right. It is one specific narrative. And I know they ended on talking kind of about like, they were bringing in that kind of labor and delivery because that's my area, that
yes,
the birth experience. And some of us were a little bit offended because we were just like, well, there's a little bit of the story here that's missing.
remember the
And
Mindy Project?
I
That was
think there's
such a
more
good
to it.
show. The Mindy Project,
It really is.
that was a good show.
And actually the showrunner and the writer is Canadian, and I would love to have him on my podcast.
Well, you should. You know, I have a little experience with all of this because 2 of my books were optioned for TV series. This was quite a while ago. Yeah, A Nurse's Story, and then the second one called, The Making of a Nurse, and they were optioned by a big, corporation, a production company with Conan O'Brien. It was amazing, and like many stories of pitching a TV show, the script was written, a showrunner was chosen, it went very far, a pilot was written, but in the end did not get the green light. But then it was optioned by Shaftesbury here in Canada, and that went on for
Right.
2 years, and a script was written. But again, it didn't get produced. But it was an amazing experience, and it just showed me that the potential is there. It's still there, even though you've got Nurse Jackie and you've got the Pit, which certainly brings in nursing. There's a potential for a huge show about nursing, and more than one.
Well, well, then we need
And
to have
people
some
should
more
contact me if
conversations
they're
because I
interested.
don't know why it's not happened yet.
Well, you and me, Amy, or you, Amy, you and someone to pair up and we could make that happen.
I think we should. And again, I think it speaks to the whole aspect of like nursing taking up space. There aren't so many nursing authors. And I think that, the fact that you've kind of blended your world in terms of what you've seen, your stories and experiences, and turn that into something that other people can digest, another kind of form of medium where it's so important for our stories to be told. So, could you tell us a little bit about the experience of becoming a nurse author?
Oh, sure. When you talked about my experience, writing about my experiences, yeah, that is what I do. I write about my experiences, and what I do is called memoir, and it's such an embarrassing word because oh, it's all about me. My kids are always saying, "Oh, it's not always about you, mom." you know, yes, a good memoir speaks to the universal. A good memoir, and I hope mine are good in the sense that it is not about me specifically. Yes, I do use myself and my own experiences, and I try to find the story that will speak to you, the reader, if you're a nurse, or you, the reader, if you want to know about nursing. So that's my goal in writing about myself, the particular specific me. But really, who is interested in that other than my friends and family? I'm not writing for my friends and family. I'm writing for people who want to know about nursing and who need to know. I would say need to know, given that it's a public health issue that they know. So I use myself, the lens of myself, and what I see. Yes, it's true, and it is memoir. I cringe when I say that word, but I do hope that it's goes beyond my little self because it's really that's what's important. It has to be a gift to the reader.
Well, I wouldn't say it's cringe at all. Like I think it's actually it's timely. It's also something that window that most people don't get because I think the way that we share our world and we share our stories, it really gives people that kind of insight into what is it that we actually do and what is it that we actually see, right? And I think that those moments are missed, right? People don't truly understand again what it's like to be doing those grueling 12 hours, being with a patient for a long period of time. Like you said, in the ICU, you're building relationships. And I think it also helps, people who are in positions of power make decisions because if we don't share those stories, we don't share because I'd also like to say that telling a story is also sharing knowledge, right? Because I think that if we don't take those opportunities to do that, someone else will take that opportunity to rewrite or write that narrative for us.
That's for
And I
sure.
think that's where it's problematic because, we're seeing it now where it's just like there are narratives that are being told about nurses that are inaccurate. Maybe some people know what I'm talking about, but again, I think that's why it's so important that we are the ones that share those stories. And again, I feel like it's also a way for people to say, "Yeah, you know what? I've been in that place too." I maybe I wasn't able to explain it in a way like how you explained it, but it opens that space for connectiveness for people not to feel alone because I can imagine that, being in an ICU that's heavy work, right? And I think that's important that we can share that load. And I think that's kind of what I do with podcasting, right? Like sharing my knowledge, having these types of conversations. And then, in writing and like in writing that we've both done, it's also sharing that heavy load that we take on ourselves in nursing, right? In terms of taking care of someone else. And I think it's important that it's kind of like offloading a little bit and it's cathartic to be able to share that as well.
It is,
I want to talk a
just
little bit.
in the trajectory, it is offloading for sure, and there is a therapeutic element to the writing aspect of it, but there's also a need to, like, rescue these stories that will get forgotten, and you did this so brilliantly with your co-author in The Wisdom of Nurses. There are many stories that have been untold or are not documented about nursing, about nurses, and certain other narratives have taken dominance, and those stories are going to be lost. I'm on a rescue mission to save them, as are you, I believe, to save these stories. Because if we tell them to each other, that's wonderful, but documenting them somehow and not letting AI take over or anyone other than us, because we own these stories.
100%. I think there's like a good parallel that we could talk about in terms of documenting our stories. It's like if you didn't document it, then it didn't happen. So I think it's really good that we really share those stories. One of the things that I found that your writing does, because some of the work that I read was particularly with in your career as being an ICU nurse, it's a place where it's both emotionally grueling and physically exhausting, where many patients are maybe end of life. How do you protect yourself from burnout? It's such a huge issue right now. And I think that many nurses are still struggling in relation to burnout. So, how do you protect yourself from burnout while staying fully present with your patients? And how do you think nursing culture around that has changed or needs to change?
It isn't new. I do a little bit of a historical review of the fact that we've had this issue of burnout in nursing and in, frankly, all professions talk about it. I mean, doctors, it's a very big issue for them too. What is burnout? I think that we have to define it not just in a global sense and what it is, get a definition, but what it is for ourselves. Each and every one of us has a different definition of what it is. And that's the key to finding the solution to it. Because I think you have to believe that there's a way out of this feeling of being burned out. There has to be a way out. If there is no way out, then you got to leave. I mean, there is no to stay and be burned out. That's tragic. That's terrible. You have to believe that there is a solution. There is a remedy for you. And so when we talk about burnout, it means so many things. At the end of a difficult shift, how you can say, "Oh, I'm burned out. Let me out of here." And it can mean that. It can also mean clinical depression. No, I think it can mean something much more serious that requires attention and maybe even treatment. It could mean just a
Right.
bad day or you need a vacation or a trip it can mean so many different things. That's why I return to my belief that you have to find what it is for yourself, what it is you need. Maybe you need to lean into work more. Maybe you need to lean out. Maybe you do need a vacation. Maybe you need counseling. Maybe there's so many solutions. You have to figure out what it is for you. And unfortunately, I think some nurses think, I'm just gonna get out of here. I can't stay because of that feeling of depletion. They don't have anything to give, or shock because of what they're seeing. I mean, it is very shocking. You walk down the hospital corridor, you're gonna see scenes that are shocking to a young person who's never seen any of this before. People crying, calling out, confused, in wheelchairs. It's very upsetting for many people who enter nursing and are young and have never seen it. It can be upsetting for old people like me when I anyone. It's just a hospital's a place no one wants to be when you think about it, probably
Right.
even the patients too. It's just a sad place, but it doesn't have to be. It doesn't have to be. I'm a big advocate of having fun at work, and that's a very good antidote, cure for burnout. When you have fun with your team and you can laugh and maybe let off steam after work, sometimes during work, and there are ways to do that in a professional manner. I think finding a fun team, finding a place where you fit in, it may take a bit of moving around to find the right place, the right environment for you. There's so many solutions, but again, they have to be tailor made. They have to be custom made to the individual. Each person needs to figure out what burnout is for them and the treatment that they require. And sometimes you need help with that, a coach, a mentor, therapist.
Yeah, no, I think you're right. Like, I think I do like the approach where you mentioned that it's kind of like not a one size fits all. You have to figure out what it means for you. And I think it's also important that you mentioned the piece of like, maybe it is clinical depression and finding out what other resources that you might need to have, and whether that's medication, whether that's combination of medication and therapy. I think those are things that we don't do very well with talking about. I don't remember ever in nursing school us even like it's kind of funny because like as soon as we got into healthcare and nursing, that the whole conversation about burnout was real, but we never talked about mitigating strategies and how to, self advocate. And I think this is where, these newer nurses kind of coming up. I don't know, what is it, Gen X? I'm not really too sure anymore, but it's just like the conversation about mental health is becoming more of something that's normalized, and it should be, where we can talk openly about some of the challenges that we're seeing, and not only just talk about them but find strategies to make sure that we can
Sure.
come back to the workplace, and then also holding the people accountable, because I don't think burnout is something that happens because just because of the pace. There are, I feel, systems that are at play that
Yeah.
cause burnout to continue to happen. Like, I call it the machine, right? Like, we're put into this machine, and somehow we try to work within this machine, but sometimes essentially how it is created and built, it's built for, not just sustainability, but also from a practical economic sense, it might not actually work for us because maybe our values don't align, our values within the machine don't align. And I think that's when we have to recognize that we have to not just say, okay, I got to take a time out for myself, but also to say, to the leadership and to the people who are creating this environment, that it's not working and it's toxic and there's things that need to change. And I think that's where nursing needs to really continue to advocate for itself as a profession, because, we can't come to nursing week because that's coming upon us and be like, let's take the pizza, the rocks that say you rock, and then, off with our next shift. We need to demand much more from our leadership in terms of making sure that our workplaces are protected, and that they do a better job of ensuring that,
This
if
kind of
they want us to
activism
come to
and
work, they want us to be
advocacy.
productive,
Yeah.
that we're doing all the right things, that they're doing the right things as well.
Yeah.
Sorry, what did you say? I missed you.
Just I was gonna build on what you said about the activism and advocacy to make change is somewhat of the cure for burnout itself. It's gonna make things better, and
Yes.
and you feel better when you're part of fixing things. Yeah,
Yes.
it's so true.
I mean, I wish I was told that, because I remember when, I think there's a lot of sense sometimes where there's helplessness. I don't know if you've seen this on your nursing units, where, we would get into the nursing room and we would talk about all of the drama, all of the issues. And then it's like that's where it died. And you went back out to do your work and all of the same issues were there. So yes, we might have spoke about them, but as soon as we left that space, it died. And I think
Exactly.
if nurses know that they can be a part of the solution and that it doesn't have to die there in your like nursing lounge, that it can actually be taken forward, then I feel that people will be empowered to actually, advocate and say this is wrong and to share their stories, to even whistleblow. I know the Canadian Nurses Association even has within their code of ethics the ability to whistleblow and the protections that there are. So again, I think that if there is a nurse out there that's listening and they feel that sense of helplessness, that's probably a sign that, one, yes, get your help, but two, that that hopelessness can be turned into action. And I really hope that more nurses will turn that hopelessness into action.
They listen to you on a regular basis, they will get you galvanized into action.
I hope so. We'll see. I want to talk a little bit about the moral courage on the floor. Again, nursing isn't all doom and gloom. And again, you mentioned the importance of having, powerful teams and finding that team that works for you. And again, I could tell you, I've had those experiences where you find that perfect fit and you're just like, where has this been all my life? You look forward to going to your shift. You're really, you're just engaged and you're happy to be there. But there is those instances and times where nursing requires moral courage, standing up to bullies, doing what's right even when it's difficult, and speaking your mind even when you're afraid. Could you share a time where you had an exercise in courage and what was really at stake?
Hmm. Wow, it's so many that I had to conjure up courage. Almost every day there was something, bullying you mentioned. I saw that and many times, and I believe that I did stand up. I did unite with that nurse who felt bullied. I don't think you can do much with the bully. I think you have to focus on the person who is feeling bullied, feeling undermined, and give them a script or give them find the words to stand up to that person. I've been a mentor for many years, and I continue to be. And I guess mentoring those people who feel that way, I guess, is an example of courage. I think just every day going in and challenging and asking questions is takes courage. As you say, you can sit in the lounge, and I've done that plenty myself. You sit in the staff lounge eating your lunch or whatever, and you talking and complaining, but to move into the next phase to find a solution takes courage for sure, because it's going to be kickback. There's going to be a backlash from management. It always is. And anything I ever did in the hospital, and I did a lot of things from newsletter, I created groups, did research, all these things on the side that were side hustles to my work in the ICU. Each one of them was fraught with resistance, and it took so much courage and to deal with that disapproval. And it just goes on and on. I've written about many of them, and it's. I hope by writing about them that nurses will feel empowered to take my example. Every single thing I ever did at the hospital and in healthcare in general, not to, because after I left the ICU, I did other things throughout the hospital, Toronto General and UHN, and then went on to other things. Every single time I raised my voice to make a change or to challenge the status quo, it was met with resistance. And it sounds pretty bleak, but it made me who I am. It was character development. And I do think I made inroads, and I did show other nurses it's possible to speak. You don't always get what you want, but at least you can speak up. It's quite a monolith that we're working against. You call it the machine. I like that. I always call it the factory. I think of it as this big factory. I like the machine. It's just intransigent. You can't work with it. It's people who are hired to say no to your ideas. Once I had this collection of plastic caps and tops that I had collected, and I made this work of art from it, and it was put in the hospital. It was a lot of fun. And then I did that. It was very colorful and was up in the hospital. The caps from the antibiotics and all the different
Yes.
medications.
Yeah.
And over all the years in the ICU, I collected bags and bags of these things. Anyway, so then I did this, and this was great. And then after it was all done and finished, I got a note from the infectious disease department. Had I considered that those little pieces of plastic could contain bacteria or, God forbid, something worse? No, I hadn't considered that because, you're going to come up against disapproval and backlash and resistance no matter what you do. That's where the courage comes in. Absolutely. But keep on at it and find people to align yourself with who feel as you do. Find strength in
Yeah. No,
numbers.
yeah, I agree. I think that like we are such a big community. And I always struggle with the fact that it's like, okay, so there's something like almost 500,000, almost 600,000 nurses in Canada. And why aren't we like a force to be reckoned with? Right? I think this is where we do need to find those channels where we can strengthen our voice, our community action, because there's so many of us. And I think that, nursing is such a powerful career. We could be so powerful in relation to lobbying that we do need to really find that collective voice and lean into it to say, hey, you know what? I would say that most of us are all on the same page with what we want in terms of healthcare outcomes, in terms of, job satisfaction. Why aren't we moving the needle? So I feel like you're right. You're onto something. We need a lot more courage. One of the things that some of your books, you talk about sisterhood and brotherhood of nursing, and readers of your books often note how powerfully you capture the bonds that nurses form with one another. So, like we were just talking about, like the camaraderie that sustains people through their hardest shifts. How do we bring people together? How are we going to create that community? And I think that maybe you've touched on a little bit, but how might we generate more support for one another and really strengthen the voice of nursing?
Well, when you take it to the team level, it is harder than ever. You have a lot of nurses who are working on a freelance basis, sort of agency nurses or travel nurses, and I certainly understand why they do that. It offers a lot of flexibility that you don't get when you have a permanent job in a hospital. There's no flexibility. You want to get a day off, for goodness sakes. I don't even want to say what the reason is because you shouldn't have to give a reason. Could be to get your nails done. Whatever. You want a day off and you give them sufficient notice. And even that, you have to bargain and wait till the last minute to see if you're going to get it. And that is why I think a lot of nurses choose other ways to nurse, freelance, as I say, or, casual work or whatever. So it does make the challenge for creating teams a lot harder and you don't always know the people you're working with. And that is definitely a challenge. Back in the day when we had these lines where the bunch of us I call it in my first book, A Nurse's Story, Laura's line. She was the leader, indisputable leader. And we knew if someone wasn't there and where's so and so and why aren't they here? We knew what they took in their coffee and when their period was. And we knew everything about each other. Maybe that's too much for people nowadays, but
No,
it
we
was.
talk to those people all the time.
I was asked recently, someone was talking to me about errors that, come up and that we make. And it's the worst feeling in the world when you make an error. And almost all of us have our own private list of what we've done wrong accidentally, and yet I remember back in the day, this is really sounding like a pioneer when our custom was if someone made an error, we always called them the next day or later that evening or the next day to see how they were doing. Because we knew
Yeah.
how devastating it was. We knew that they were lying in a corner in a dark place somewhere, coming
Yes.
down on themselves and how bad they felt. And I don't know if that goes on nowadays because people want their privacy. People want to keep a distance. People don't want to share. It's about privacy. That whole thing about privacy is taken to some extremes. And I don't know. I thought it was very comforting whenever someone would call me, see how I was doing. And I know that I offered comfort by doing that little practice. We always did. If someone didn't want to talk, of course we wouldn't press it. But most of the errors we make are either fixable or cause minimal harm, but they still cause us a lot of distress. And
It's stress.
yeah, so that's an example. It is a challenge to create team, but I dedicated my latest book. It's called The Handover, A Nurse's Last Shift, and my dedication in that book is to those who stay. And really, those who stay, if you stay and keep at it, you can work through all these things. Work through the burnout, work through the challenges of moral courage, work through finding a team. If you stay and keep showing up and really work on it you can make it better. You can make a team. You can develop your moral courage, but you can't run away all the time or at all, really.
Yeah, no, I think I'm glad that you talked about your book because we're gonna have another podcast with your co-author.
Yes.
But I think it's so important that, we do give ourselves one, the grace, and then two, those tools, right? I think that's what's probably lacking, right? And I do feel like there's a little bit of miss in terms of how we talk to one another in terms of that compassion. I think that's not just a specific to nursing. I think that's just specific to all healthcare professionals, the aspect of really reaching across the table and being able to show compassion to someone in the face of whether it's an error or anything else that has occurred. I do feel like I don't remember that really happening in my time. There's so much still shame and stigma around those things. I know that we talk about, like, for example, I worked in quality improvement and we're supposed to be in an environment of no shame, no blame. But it's hard when, as opposed to your colleague pulling you to the side to say, hey, you might have missed this. Now it's this kind of, you've been reported behind your back and you're only finding out through the grapevine and things like that. And I feel like some of those aspects are lost. And I mean, I comb nursing school boards and various different things on social media, and those questions are still asked where it's just like, I'm in a dark place and I wish someone would have a conversation with me, or, this has happened, but I don't feel supported. And I think this is where we do ourselves a disservice as nurses, as colleagues, when one of our own feels so isolated from the profession that I think we need to ask ourselves, like, what are we really doing? Because we've all been there. We've all had it. We've all made a mistake. We're not perfect. And I think it's important that, who is the best person to make another nurse feel great? It's another nurse. But who is also the person who could do the most harm to a nurse is another nurse. So I think that we need to really take those lessons and kind of put ourselves back into those seats of someone who might be newer practicing, or maybe even not newer, and to be like, how would I want to be treated if this happened to me? Like, it's a really kind of simple principle. Just say, you know, treat someone how you would want to be treated, right?
So true. Basic, but often missed. You're right.
Yeah, absolutely.
Yeah.
So is it your last book? I don't know. I don't want to say that. Let's
I'm
not say
I'm
that.
very interested right now, mentoring other nurses to write their books, and if they want help, all they have to do is contact me. Uh, I'm also involved in setting up a curriculum for a course in writing creative writing that I hope to announce
I,
soon.
I like that.
And that will be my way of mentoring and sharing my writing secrets, what worked for me, and I hope that that will start up soon. I'll make an announcement on social media about that once I have the details for that. That's with
Yes,
CHEN, which is
please.
the Canadian Health Education Network. Yeah, so
Oh my
that's
goodness.
really. As for another book about nursing, never know. I'd like to collaborate. I love collaborating, as I did with Lisa Mockery, with my co-author of The Handover, and I love that collaboration, especially because Lisa's younger, much younger than me. She was just starting her career, and I was on the brink of retirement. That whole dynamic was really great for Lisa and me.
Yeah, no, I love the concept of the handover, and I can't wait till we have that conversation with your co-author as well.
Yes.
But before we go today, is there anything that we missed that we haven't touched on, that you would like to touch on today?
Oh gosh, there's so much to say about nursing. My friends say to me, "No, another book about nursing. Tilda, haven't you said all there is to say?" This is one of the voices from Laura's line, who's always teasing me, my original OG group of nurses. Who haven't you said everything? No, not at all. But it's for others to speak. I'm not in it anymore, in as direct patient care. Well, a little bit. I do dabble, but I really it's my time to bring out the voices of other nurses and to mentor them, because you can learn to write. We all have the stories. It's not like you don't have the material. We all have the stories. It's just, and you don't have to be a good writer to write. You can learn to be a good writer. You can improve, and you can learn the secrets and the techniques and of how to tell a story, how to shape a narrative, and how to edit yourself, and all of that. And that's what I plan to teach in this course.
Yeah, no, I'm looking forward to that, and I think that nurses, like, I think I really want nurses to see themselves as artists, right? I think that at the end of the day, we talk about nursing being a science and an art. Writing is an art. Expressing yourself in a different medium, that's art. And I still feel like that is one of the, fundamental principles within nursing, because some people are like, "Oh, art, it's woo-woo." It's not. It's actually, there's so much more to nursing as a profession. And really, I think that is another piece that we haven't really dived into, that art of really sharing a narrative and writing out a story and using that creative element that I think a lot of nurses have that they haven't maybe tapped into. So I
Right?
really look forward to pointing nurses in your direction in terms of learning how to creatively write and really kind of bringing out their voice in a different way.
Yes.
Where can people find
Not
you?
just writing, what about painting and songwriting and script writing and
Right?
screenwriting and there's so many avenues.
Oh, we're coming. We're coming for all of those spaces. Where can people find you, Tilda?
What is it? Tilda at nursetilda.com. And my Instagram is nurse.tilda, nurse.tilda, and not nurse Tilda. Someone else has that handle, believe it or not. Nurse.tilda, and then Tilda at nurse Tilda. And give out my phone number if you like. Amy, I'm very available. Facebook.
Yeah, well, I'll leave the phone number for people might reach out to me
I wish
directly.
the phone was ringing off the hook. I'd love to hear from people, but it's not.
Absolutely. It was a pleasure to speak with you today, Tilda. I think our paths will continue to cross. I think that there's been some interest and things generated that I feel like that there's some work that we could do together.
Wonderful.
Um, please stay in touch. We'll be talking in the next couple weeks, so we could talk to your
Yeah,
co-author
love
about.
what you do. Keep on doing it. The name alone, the title, The Gritty Nurse, is fantastic. That alone says it all. And yet you do amazing work. Each and every podcast is
Oh
fantastic.
my goodness, thank you. That means a lot coming from
Oh, it
you as well.
really
Thank you.
is.
So thank you for coming on to the Greeners
Pleasure.
podcast. Until next time,
Yes.
and when we have you and your co-host, but such a wealth of knowledge and such so much work that you've put into your writing and sharing how nursing
Oh,
looks like, so other people can have a better perspective and that bird's eye view of what we actually do from a nurse and not from another discipline or profession.
that's right.
It has to come from us, right, Tilda?
For sure. Absolutely. And we can do it.
Yes, absolutely.